Joining us now, Secretary of Health and Human Services, Xavier Becerra. He is currently in Alabama right now to meet with doctors and IVF patients across the state. Thank you, Mr. Secretary, for joining us. What are you hoping to accomplish there? There's a lot of confusion for parents who have embryos that are right now being frozen, who want to turn to IVF. They don't know if they'll be prosecuted or if they have to do what Amanda is doing.
Mika, thanks for having me. And as your report just pointed out, there's a lot of fear. There's a lot of confusion. Now you don't need to add the politics to add fear, confusion, and perhaps prosecution to that mix for someone who simply wants to have a family. But that's where we are. And that's what happens when you finally connect the dots between the Dobbs decision and Roe versus Wade. Many of us have said this before. This isn't just about abortion. This is about access to health care. And there are millions of families out there who want to start having their children, and they thought they'd be able to use in vitro fertilization. We're now beginning to wonder, why am I in the same trap that a woman who's looking for abortion care services or contraception is now facing? They're not sure what's going on, but they are confused, they are fearful, and in some cases they're thinking of moving out of the state, or in this case, moving their embryos out of the state.
Mr. Secretary, we're focused on IVF because of the Alabama ruling, but there are currently 3 states, I think it's Texas, Louisiana, and Missouri, who are also looking, where the legislatures are looking at restricting access to morning after pill and even to intrauterine devices as well. What more is coming down the line? What more should parents and would-be parents and women in America be afraid of? What other restrictions do you think could happen?
Well, just as this Alabama decision threw everyone for a loop and really broadsided so many families that are using IVF, that's what could happen again. Remember, the rights that we had under Roe were stripped by Dobbs. Where that takes us, well, now we're seeing it's certainly well beyond abortion. It could easily go beyond IVF. It's not clear, and that's why there are a lot of very fearful, confused families right now.
Mr. Secretary, good morning. It's not just Alabama. This isn't just a one-off, as you say. I'm looking back at the Life at Conception Act, which was co-sponsored by a group of Republicans in January of 2023, including now Speaker Mike Johnson, which says life begins at conception, which means the embryo is life, the embryo is a child. What are your concerns that this legislatively could be passed through on a national level, some of this?
Well, my understanding is that a majority of Republicans in the House of Representatives have endorsed that legislation, which means that the leadership of the Speaker and more than half of his constituents in the House of Representatives are for this legislation, which would certainly put at risk not just those in Alabama, but folks throughout the country if it passes as a federal law. And so here we are with a situation where before Dobbs, those rights to access care, whether it's in vitro fertilization or abortion care, were protected constitutionally by Roe versus Wade. That's all gone. Who knows where we go? It's a wild, wild west, and we have to do everything we can to protect families. That's why I'm here in Alabama today.
So, Mr. Secretary, since this decision in Alabama, some Republicans have tried to distance themselves from it, but as just noted, that could just be politics. It's an election year. We'll see what happens were they to take power. In the interim, though, in Alabama, where this is in effect, are there executive orders the White House, the administration are exploring? What sort of granular things can you and your team do to help?
Yeah, we will talk to families today, talk to physicians, see if there's something we can do at the federal level. But the reality is, until we restore the rights that we had under Roe, my 3 daughters, will continue to have fewer rights than my wife has. And it's a chilling thought that we go back to those days when it was illegal to do things that are good for your health, where it is good for your family to be able to plan out in vitro fertilization. It is a real fear to believe that you might face prosecution simply for trying to have a family.